If you are over 60 and walk every day, there is something you probably haven't been told, and when you understand it, you will no longer see your routine the same way. Because yes, walking seems enough, it feels good, it even makes you think you are doing the right thing, but the reality is different. Walking does not stop what is happening inside your body right now. Even if you don't notice it, even if you feel active, after 50 you can lose up to 2% of muscle mass each year, and that continues to happen even if you don't miss a single day of walking. The problem is that this loss does not warn you, it does not hurt at first, but it accumulates, and when you realize it, there is already less strength, less stability, and something more dangerous, insecurity when moving. That is where falls, stumbles, and dependence begin. And the most uncomfortable part of all this is this: many people believe they are doing enough, when in reality they are falling short. But here is where it gets interesting, because it is not about doing more, nor about spending hours training. It is about doing what is right. Your body can still recover strength, stability, and control, but only if it receives the right stimulus. And there is one specific exercise that almost no one does, that completely changes how you move, how you feel, and how your body ages. Stay, because that detail can be the difference between maintaining your independence, or starting to lose it without realizing it. And when you see it, you will understand why walking was never enough. Exercise 1. Calf activation. Calf activation is, probably, one of the most underestimated exercises, and at the same time one of the most decisive when we talk about functional aging. Because here we are not just talking about muscle, we are talking about a complete system that directly influences your stability, your circulation, and, in many cases, your independence. The calves function as a peripheral pump, what in physiology is known as the muscle pump. Every time they contract, they push the blood back toward the heart, helping the venous system overcome gravity. Over the years, this mechanism loses efficiency if it is not stimulated, and that translates into heavier legs, swelling, nighttime cramps, and a constant feeling of fatigue when walking. But here is what almost no one tells you: when this pump fails, it not only affects circulation, it also compromises your balance. Why? Because the calves are key in fine posture adjustments. They are the ones that react in milliseconds when your body tilts slightly forward or backward. They are your automatic correction system. And if they are weak, that system responds late, or does not respond. That is where unexplained stumbles appear, the small losses of balance that seem insignificant, but over time become real falls. Studies in postural control have shown that weakness in the ankle musculature, especially in the plantar flexors, is directly associated with a higher risk of falls in older adults. It is not a coincidence, it is pure mechanics. Your body depends on that area more than you think. Now, the interesting part is not only understanding this, it is how quickly you can start to change it. Because unlike other larger muscles, the calves respond very well to simple and frequent stimuli. But here is the nuance that makes the difference between doing the exercise and obtaining real results. It is not just about raising and lowering your heels. It is about doing it with intention, with control, and understanding what you are activating. When you slowly raise your heels and hold for a few seconds at the top, you are forcing the muscle to contract in a sustained way, which improves both strength and muscular endurance. And when you lower in a controlled manner, you are working the eccentric phase, which is key for joint stability. This type of contraction has been shown to be especially effective for improving muscle function in older adults. In addition, by repeating this pattern consistently, you are training your nervous system to react better to changes in balance. That is, you not only get stronger, you become more reactive. And that completely changes how you move in your daily life. Climbing stairs becomes easier, standing for longer stops being exhausting, and walking no longer feels like an unsafe act. There is even evidence that this type of exercise improves proprioception, which is your body's ability to know what position it is in without needing to look. And that, after 60, is pure gold. Because when you recover that internal connection, you stop moving with fear and start moving with control. And the most powerful part of all this is that you are working an area that almost no one trains, which means that results not only come, they come quickly. You do not need machines, you do not need long routines, you only need consistency and to understand that something so simple can be the difference between feeling unstable, or trusting every step you take again. Exercise 2. Squats. Squats are not just another exercise, They are a direct test of your physical independence. And this is not an exaggeration. There is a clinical test widely used in geriatrics called the sit-to-stand test, which basically measures how many times you can get up from a chair without help. Why? Because that movement summarizes everything you need to live without depending on others: leg strength, hip stability, core control, and coordination. When that pattern weakens, not only does it become harder for you to stand up, you start to avoid it. You sit for longer, you move less, and without realizing it you enter a cycle of progressive decline. This is where the squat stops being an exercise and becomes a functional survival tool. Because each repetition is strengthening the most important muscles for your daily life: quadriceps, glutes, and hip stabilizers. And there is something deeper that almost no one mentions: this movement also stimulates bone density. Studies in the physiology of aging have shown that load-bearing exercises, such as squats, help maintain bone mass and reduce the risk of osteoporosis, something critical after 60. It is not just strength, it is structure. It is the difference between a body that resists and one that becomes fragile. And here comes the uncomfortable point: many people walk every day, but cannot do even 5 controlled squats. That is not a minor detail, it is a clear sign of loss of functional capacity. Now, what makes this exercise truly powerful is not only what it works, but how it impacts your confidence when moving. Because when you know you can stand up without effort, climb stairs without fear, or bend down without losing balance, your behavior changes. You move more, you expose yourself more, and that breaks the cycle of deterioration. But here is the nuance that separates those who get results from those who don't: execution. It is not about going down quickly and coming up however you can. It is about controlling the movement, keeping the weight well distributed, activating the core, and making sure that the knees follow a stable path. There is even evidence that the eccentric phase, when you go down slowly, generates greater muscular adaptations and improves neuromuscular control, something key to preventing falls. And if at the beginning you cannot do a full squat, that is okay. You can start with a chair as a reference, lowering until you touch it and coming back up again. That is already enough stimulus to start rebuilding strength. What matters is consistency, because this exercise has a brutal cumulative effect. In a few weeks, what used to be difficult becomes automatic. And that is where the real change happens. Not only do you get stronger, you regain autonomy. You recover the ability to move without thinking about every step. And that, after a certain age, is not comfort, it is freedom. Because losing the ability to do a squat is not losing an exercise, it is starting to lose independence. And recovering it does not depend on the time you have, but on the decision to start. Exercise 3. Push-ups. Wall push-ups seem too simple to generate real change, and that is exactly the mistake most people make. Because this exercise is not about pushing a wall, it is about reprogramming how your body supports itself. Over the years, especially after 50, something silent but constant happens: the postural muscles weaken and the body begins to collapse forward. Drooping shoulders, forward head, hunched back, it is not just an aesthetic issue, it is a clear sign that your support system is failing. And when that happens, your center of gravity shifts, your balance becomes unstable, and walking stops being a safe act and becomes a progressive risk. This is where wall push-ups come in with more power than they seem to have. By pushing against a fixed surface, you activate in a controlled way the chest, the shoulders, and, most importantly, the deep core, which is truly responsible for keeping you upright. Studies in biomechanics have shown that closed-chain pushing exercises, like this one, improve neuromuscular activation and joint stability, something key in older adults. You are not just building strength, you are teaching your body to stabilize itself again. And that has a direct effect on something that almost no one connects: your way of walking. Because when your upper body is aligned, your steps become safer, firmer, less compensated. But here is where it becomes even more interesting. Because it is not just about activating muscles, but about regaining control. Each well-executed repetition sends a signal to your nervous system: this is how I should support myself. And that changes everything. People who incorporate this type of stimulus consistently not only improve their posture in a few weeks, they also reduce fatigue when walking, decrease discomfort in the neck and back, and even breathe better. Yes, breathe better. Because a hunched posture compresses the rib cage and limits lung capacity, while an aligned posture expands it and improves oxygenation. Now, what almost no one tells you, it does not matter how many repetitions you do if you do it wrong. If you do not keep your abdomen active, if you let your head drop, or if you push without control, you lose a large part of the benefit. Here quality rules, not quantity. And the powerful thing about this exercise is that you do not need equipment, you do not need experience, and you do not need more than a few minutes a day to start noticing real changes. This is the kind of exercise that seems small, until you understand that it is correcting the foundation on which everything else is built. Because when you recover posture, you recover balance, and when you recover balance, you recover safety. And that, after 60, is not optional, it is essential. Exercise 4. Marching in place. Marching in place seems like the typical exercise anyone could ignore, too simple, too basic, almost ridiculous if you compare it with other more complete routines. But that is where the mistake is. Because this movement, when properly understood, is not just any cardiovascular exercise, it is a direct tool to reprogram your neuromotor system, which is the true responsible for how you move, how you react, and how stable you are with each step. As you age, you not only lose muscle, you also lose something more critical, intermuscular coordination and the response speed of the nervous system. In other words, your brain takes longer to send signals and your muscles take longer to execute them. That is what turns a small stumble into a fall. And this is where marching in place comes in with a power that is not obvious at first glance. By lifting your knees alternately, maintaining rhythm and coordinating arms and legs, you are forcing your brain to work in constant synchronization. You are activating what in neuroscience is known as cross patterns, where opposite hemispheres of the brain communicate to coordinate complex movements. This type of stimulation has been shown to improve neural plasticity, which is the brain's ability to adapt and reorganize, something fundamental after 60. And not only that, you are also training dynamic balance, which is completely different from static balance. It is not about standing still without falling, it is about maintaining stability while you move, while you shift weight, while you react. And that is exactly what you do when you walk in real life. That is why this exercise is not an imitation, it is a controlled simulation of what your body needs to master outside. Now, the interesting part is how something so seemingly simple can generate real changes in your safety when moving. Because when you do marching in place with intention, lifting your knees well, keeping your torso upright, coordinating arm movement, you are creating a kind of neurological rehearsal that then transfers directly to your way of walking. Studies in geriatric rehabilitation have shown that simulated gait exercises significantly improve coordination, step length, and overall stability in older adults. In other words, you do not only move better during the exercise, you move better all day. In addition, this type of activity slightly raises the heart rate without generating impact, which makes it a safe option for people with joint limitations. But here comes the detail that makes the difference between just doing it and doing it well: rhythm. If you do it without control, without intention, you lose a large part of the benefit. But if you maintain a constant rhythm, if you focus on coordination, if you feel how your body responds, then you are training something much deeper than muscle. You are fine-tuning your movement system. And that has a brutal cumulative effect. People who incorporate this type of stimulus daily not only improve their agility, they also reduce the fear of moving, which is one of the most limiting factors after a certain age. Because when you recover coordination, you recover confidence. And when you recover confidence, you move more. And when you move more, you enter a cycle completely opposite to deterioration. This exercise does not seem like much, until you understand that it is attacking one of the most invisible problems of aging: the disconnection between what your brain wants to do and what your body can execute. Exercise 5. Lateral leg raises. Lateral leg raises are, without exaggeration, one of the most ignored exercises, and at the same time one of the most critical when we talk about preventing real falls. Because here we enter a territory that almost no one trains consciously: lateral stability. Most people focus on moving forward and backward, walking, climbing stairs, getting up, but very few prepare their body to respond when balance is lost to the side. And guess what? Most falls in older adults do not occur forward, they occur laterally, in a second, without warning. A small stumble, a poorly calculated change of direction, an uneven surface, and if your body does not have the ability to stabilize in that plane, there is no reaction that can save it. This is where the gluteus medius comes in, the true protagonist of this exercise. This muscle, located on the lateral part of the hip, is responsible for keeping the pelvis stable every time you take a step. Every time you lift one foot off the ground, the gluteus medius on the opposite side activates to prevent your hip from dropping. If this muscle is weak, and in most older adults it is, your body loses alignment, your step becomes unstable and compensations begin. What at first seems like a slight lean when walking, over time becomes an unsafe gait, with higher energy expenditure and greater risk of falling. Studies in biomechanics and postural control have shown that weakness of the gluteus medius is directly related to gait alterations and increased risk of lateral falls. It is not a theory, it is a repeated pattern. And the most concerning part is that this deterioration occurs silently. It does not hurt, it does not warn you, until one day it fails. Now, what makes lateral leg raises so powerful is that they attack this problem in a direct and specific way. You are not working a large muscle for aesthetics, you are strengthening a stabilization system that can literally prevent a fall. But this is where most people make a mistake. They do it fast, without control, without understanding what they are activating. And that way they lose a large part of the benefit. When you lift your leg to the side slowly, keeping your torso firm and avoiding leaning, you are forcing the gluteus medius to do exactly its function, stabilize. You are training that muscle to respond when you really need it. In addition, this exercise improves lateral proprioception, which is your body's ability to detect changes in position to the sides. This is key, because many falls occur not due to lack of strength, but due to lack of reaction. And here you are working both things at the same time. There is even evidence in fall prevention programs that shows that including hip abduction exercises, like this one, significantly improves stability and reduces the incidence of falls in older adults. And there is another detail that makes the difference: core control. If you keep your abdomen active while doing the movement, you are integrating hip stability with trunk stability, creating a more solid and coordinated system. The interesting part is that the results are not only felt during the exercise, they transfer to your daily life. You walk with more confidence, you react better to imbalances and, above all, you reduce that silent fear of falling that many people begin to develop over the years. Because when your body responds, your mind relaxes. And when that happens, you move better. This exercise is not flashy, it does not impress anyone, but it is the kind of work that makes the difference between a life limited by fear and a life sustained by control. Exercise 6. Glute Bridge. The glute bridge is one of those exercises that seem too simple to take seriously, until you understand what is really happening in your body when you do it correctly. Because here we are not just talking about lifting the hips, we are talking about reactivating one of the most important, and most forgotten, muscle groups in older adults, the glutes and the deep core. Over time, especially if you spend many hours sitting or with little specific activity, these muscles turn off. They literally stop activating efficiently, which in physiology is known as muscle inhibition. The result? Your lower back begins to compensate. In other words, your lower back does the work that your glutes should be doing. And that is where the problems begin: lower back pain, stiffness, a feeling of weakness when standing up or walking, and even greater instability in the hips. The glute bridge corrects exactly that pattern. By lifting your hips off the ground, you activate the posterior chain in a controlled way, especially the gluteus maximus, which is responsible for hip extension, a key movement in practically everything you do: walking, standing up, climbing stairs. Studies in rehabilitation have shown that this exercise improves neuromuscular activation and significantly reduces the load on the lumbar spine, which makes it a fundamental tool to prevent and relieve back pain. But here is the important part: it is not just relief, it is re-education. You are teaching your body to use the correct muscles at the right time. Now, what makes this exercise truly powerful is not only what it activates, but what it corrects in the long term. Because when your glutes start working the way they should again, your entire movement system changes. Your posture improves, your stride becomes more stable, and something key, you reduce unnecessary stress on your joints. This is not minor, because many discomforts in the knees or hips do not come directly from those areas, but from poor force distribution caused by weakness in the posterior chain. In addition, the glute bridge has a component that few people value enough: core stability. By keeping your hips elevated and your abdomen active, you are strengthening the deep core, including muscles such as the transverse abdominis, which act as a natural belt for your spine. This improves overall stability and reduces the risk of sudden or uncontrolled movements that can end in injury. And there is another key detail that makes the difference between doing it and doing it well: the mind-muscle connection. If you simply go up and down without control, you lose a large part of the benefit. But if you focus on squeezing your glutes, on keeping your pelvis stable and on controlling each repetition, you are maximizing muscle activation and the impact of the exercise. There is even evidence that holding the position at the top for a few seconds increases activation and improves muscular endurance. And the best part is that this exercise is accessible, safe, and adaptable. You do not need equipment, you do not need prior experience, you only need consistency. Because here it is not about doing something spectacular, it is about doing something effective. And when you start to notice that your back hurts less, that you stand up more easily, and that your body feels more stable, you understand that this exercise was not optional. It was necessary. What you just saw is not just any routine, it is a system designed to attack the exact points where the body begins to fail with age. And if you notice, each exercise fulfills a specific function that, separately, already provides value, but together they create something much more powerful: a body that responds again like before. Wall push-ups correct posture and restore alignment to the upper body. Calves reactivate circulation and fine-tune the subtle adjustments of balance. Marching in place reconnects your brain with your body, improving coordination and agility. Squats rebuild the base strength that supports your independence. The glute bridge protects your lower back and reactivates the posterior chain. And lateral raises strengthen that lateral stability that prevents unexpected falls. This is not a coincidence, it is strategy. You are covering posture, strength, balance, coordination, and control, the 5 pillars that determine how your movement ages. And here is the important part: you do not need to do it perfectly, you need to do it consistently. Because the body does not respond to what you do one day, it responds to what you repeat. And when you repeat correct stimuli, you begin to notice something that many people believe is impossible after a certain age: real improvements. Now, the most interesting part of all this is that the changes do not start in the muscle, they start in the nervous system. From the very first sessions, your body is already learning, adjusting, reactivating pathways that were dormant. That is why many people feel improvements in stability and control even before gaining visible strength. It is an internal adaptation that then translates into safer, more fluid, more confident movement. And that has a chain effect: you move more, you get tired less, you feel more capable, and without realizing it you break the cycle of deterioration. Because the real problem is not age, it is specific inactivity. And here you are attacking that head-on, with simple but intelligent stimuli. You do not need machines, you do not need endless routines, you do not need to complicate things. You only need to understand that these exercises are not optional if you want to maintain your quality of life. They are a direct investment in your independence. And the most powerful part is this: each repetition you do not only strengthens your body, it reinforces the idea that you can still improve. And that completely changes the way you face the passage of time. Your body did not become weak because of age, it became weak due to lack of stimulus. And that is great news, because it means you can still change it. You do not need hours, you do not need equipment, you do not need to wait until you feel pain to react. You already saw what really works. Now the difference is not in knowing it, it is in doing it. Because every day that passes without activating your body is one more step toward dependence. But every repetition you do starting today is a direct step toward regaining strength, stability, and control. And that is not theory, it is what your body is waiting for you to do. Now it is up to you. If you made it this far, comment "I start today." Not as cheap motivation, but as a real commitment. Like the video, subscribe to the channel and save this routine, because if you do not apply it, it is useless. And if you know someone who is losing mobility without realizing it, send them this video. Sometimes the only thing someone needs is to be shown the right path. And there is something I did not tell you before. These exercises work, but their impact changes completely when you do them within a correct structure. Because doing them well is only the first step. Knowing when to do them, how to combine them and how to progress without getting stuck is what truly transforms your body. Thank you for watching this video and see you soon.